arguably the world's most beloved sport. For children, it's more than just a game. It's a source of joy, a way to stay active, and an important part of their development. However, soccer is one of the riskiest sports for knee injuries, with millions of children worldwide experiencing the pain of one each year. In the short term, these children require surgery and months of rehab. In the long term, there could be an over 400% increased risk of early onset osteoarthritis, not to mention the emotional and financial burdens. Knee injuries are on the rise, and there's a pressing need to study how they are caused. Now, researchers have tried to study knee injuries, but there's still a problem today. As an example, let's look at Sophia playing here. Notice how her knee bends inwards at some angle. But as researchers, we don't know what that specific angle is, nor do we know the tipping point that leads to injury. All we know from in-lab studies is that there's a very small margin for injury. If Sophia's knee angle here was just a hair too inwards, her injury risk could suddenly become a lot larger. But researchers currently lack technology that's advanced enough to measure such narrow margins on field. If we can't identify these movement thresholds and margins, then how can we start to make effective injury prevention strategies? So, our team went ahead and developed a new research method. This wearable device, which can be worn during soccer to measure knee movement, including knee angles. What makes our device novel is that it seamlessly fits into typical soccer gear. One part is embedded inside their usual shin pads worn for safety, and if they take a hard kick to the shins, they won't feel the device at all. The other part is on the thigh, embedded into their usual compression shorts, all hidden beneath their soccer uniform. The best part? We can calculate knee motion without directly touching the knee. Thanks to our design, the 21 players, parents, and coaches we have interviewed so far have felt really safe and comfortable with the device. The players that tried it all on felt that it wasn't restricting or distracting while playing soccer. Now, why does this research device matter? It's still ongoing, but we've shown we can measure athletes' movements right where they play and get injured. In the future, this device could be adapted for other sports and be deployed nationwide, again to improve our understanding of injuries. In closing, let me leave you with this thought. Every time a young athlete steps out onto the field, they carry their dreams and passion, but they also carry the risk of a life-altering injury. Our goal is to protect children and ensure that all kids can play with confidence and safety. Thank you.
Do you have any questions for Bonnor?
Super cool. What's the next step with the device? So we need like a good amount of time to continue developing it to really make sure that it's accurate and again able to measure such precise margins, especially on field. It has a level of complexity too. Working on validating that, continuing to scale it down so it's more and more comfortable. But we're looking at like more than 5 years down the road still, but it's really exciting.
Is there a particular age group that you tried this out on? Have you tried it on younger kids yet, or is that even an option for?
We wanted to, but ethics. So just in the time that we worked on it, we just worked on players who did play soccer when they were younger, but just like young adults, yeah.
5-10 years down the road, when this is like implemented in soccer and also other sports, the final device, what would it do?
Exactly. So the final device would be able to measure their knee motion, ideally really accurately in different planes, and that information is really important for clinical researchers to be able to understand when is a kid gonna tear for example, their ACL or any other knee injury, and when are they safe. And once we understand these kind of biomechanical corridors, these thresholds, then we can start to make really effective injury prevention strategies. Right now there are programs, but they're not, we totally don't know if they work exactly. So once we have that data to know exactly, we can really focus on effective prevention strategies, ways to measure their movement, make sure they're adhering to their programs, lots more.
Does the surface make a difference? So if you're on a grass field or artificial turf, could you perhaps be at the same angle but not sustain a severe injury on one type a playing surface versus another?
That's exactly, these are the kind of questions we want to discover or investigate, because currently we only really measure players in the lab, but there could be effects to if they're on turf or grass, what kind of cleats they're wearing, what any other sport that they're involved with. It could make a difference, and that's a really wonderful question. We'd love to investigate that in the future.
Is there any piece of this looking at also personalizing this to whether kids are more genetically at risk due to hyperextensibility? As a mother of soccer players, and seeing the kids that sustain these, it's not only overtraining and et cetera, but it's certain kids with a little more hyperextension at their knee and other things. So perhaps looking at the genetics of hypermobility and providing that for kids to know what to prevent before they overtrain.
Definitely. And in fact, we want to be able to collect this movement data on as many kids as possible to see what other things like that could be a big factor. Yeah.
In your cohort, does it include both boys and girls, like both genders? Because I play a similar sport to soccer called ultimate frisbee, so the motions are really similar. And 7 out of 7 of my peers who've had ACL repairs are all female.
Yeah, we know that females are more likely to get an ACL tear. Ideally, different sexes, different sports, activity levels, any possible demographic data, we need all that information because we don't know exactly all those different details. Yeah, but definitely for girls and boys.
Just wondering, this is a lot of data that you're proposing to us. How are you going to find any meaning from it? Like, how are you going to analyze it? Have you thought about, once you have the data, are there specific software or things that you can do to help figure these things out?
Yeah, it's definitely a big data problem. Thankfully, we have machine learning tools to be able to kind of really reduce the dimensionality of this data and figure out these specific patterns. So there's definitely the tools and methods there, and it's all very new territory for everyone in the field. Sure.
Could these be applied to any other joints?
Yeah, I mean, we could see it being used for the elbow for baseball, tennis, anything like that. It's similar technology mechanics. It just has to be tweaked and adapted for the exact application.
So think about the knee and then just upstream the hip. Is there, do you think, this may be a Tim question, but do you think it's like, knowing that, like, quite honestly, my own knee injury had to do more with the hip. So is there a way that the data could look like, oh, that's not the knee, that's upstream?
Sure. I think that ties in kind of with Sarah's question as well too. Like, whenever there's an injury at the knee, from a biomechanical perspective, something's going on in the whole body. And so it's not just that one knee angle, it's where's your weight distribution, where's your hip placement, the internal, external rotation. The issue that Mona very clearly identified is that we don't know which of these parameters are really important. And then you get into different things like, what if you're playing on turf? And it is very much a big data problem. And so using those machine learning tools that Mona mentioned, principal component analysis, to understand what is important, what do we need to look at, that will help us really factor down to where are the really important factors that we want to intervene on. But absolutely, it's never a one joint thing when it comes to the body. We have to look at everything.